In this video, we present a new arthroscopic meniscus repair technique, the circumferential fiber augmentation. The patient suffered a radial tear of the mid-body of the lateral meniscus on plane circle. First, the torn site is derided by a shaver. A long needle is inserted from the medial aspect of the knee and the direction of the needle is confirmed, and a far anteromedial portal is created. Through the portal, a needle attached to an artificial ligament tape is penetrated from outer rim of the anterior horn of the meniscus to the anterior lateral capsule. Then, in the same fashion, after the direction of the needle is confirmed, conventional meniscus repair suture is inserted from the anterolateral capsule to the outside of the posterolateral capsule. A loop for suture relay is created on the suture and the artificial ligament tape is passed through the outside of the posterolateral capsule. Another conventional meniscus repair suture is inserted from beneath the posterior horn of the meniscus to the posterolateral capsule by inside-out technique. A loop for suture relay is created on outside the posterolateral capsule and the artificial ligament tape is pulled in the new joint. Tibial bone under the anterior horn of the meniscus is exposed and the ligament tape placed on the anterior horn of the meniscus is fixed into the bone by an anchor. Then the tape is cut. By using a tibial aimer for SCL reconstruction, 2.4 mm K-wire is drilled from the anterior aspect of the tibia, just proximal to the pes anserinus, to the posterior attachment of the meniscus. Through the drill hole, the artificial ligament tape is pulled out to the outside of the anterior aspect of the tibia. Then the torn stumps are confirmed to be reduced by pulling the tape on the anterior tibia. While arthroscopically the torn stumps are reduced, the ligament tape is fixed on anterior tibial bone. Finally, to stabilize the torn site, inside-out repair sutures are aided by using the zone-specific cannula system. For this patient, 3 conventional sutures for mid to outer limb and 1 ligament tape for inner limb are applied. Then it can be seen that the meniscus tear is completely repaired.